introduce my colleague, Ed Maibach, who is the moderator of the next session, which promises to be also incredibly engaging and informative. And there's just so much, the treasure of these sessions is really beyond compare. So Ed, it's your turn. I hope you're there to take over the moderating. Ed is the director of the Center for Climate Change Communication, which is where the consortium is located. So that is our home. And we are very grateful to be there. And I turn it over to you now, Ed. Thanks.
Thank you, Mona. Thanks for the pass off. And yes, we have an amazing session coming up, actually starting right now, a session with 5 of my most amazing heroes as our speakers, as our panelists. They will be talking about optimizing and accelerating the power of health professionals as champions for equitable climate and health solutions. So I'm just going to introduce them all very briefly right now. So we've got the bios out of the way, and then we will, each one will take about 5 minutes. They're expecting that, and then we're going to try to have about 15 minutes at the end for open conversation and engagement with you all. So our first speaker is going to be Dr. Cheryl Holder. Cheryl is an internist and an associate professor of medicine, as well as the associate dean at Florida International University's College of Medicine. She also co-founded and co-chairs the Florida Clinicians for Climate Action. Our second speaker will be Dr. Nicole Redvers, who is an assistant professor of Indigenous Health in the School of Medicine and Health Sciences at the University of North Dakota. And she co-founded and co-chairs the Arctic Indigenous Wellness Foundation. Our third speaker, Dr. Erica Browne, is a program officer at the Kresge Foundation, who, full disclosure, is a major funder of the consortium. So thank you, Erica. Thank you, Kresge. Erica has also served as a faculty affiliate at the California Initiative for Health Equity and Action. And like myself, actually, she was formerly a Robert Wood Johnson Foundation Health Policy Research Scholar. Our fourth speaker will be Dr. Markley Alexander, who's a clinical professor of physical medicine and rehabilitation at the University of Alabama, Birmingham School of Medicine. She's also the president of Sustain Our Abilities, which is the only 501c3 that focuses on environmental justice for people with disabilities. She's also the founding editor-in-chief of our field's one and only journal called the Journal of Climate Change and Health. I hope you are all active readers and contributors. And our final speaker is my friend Cyrilli Patel, who is currently the vice president at the Metropolitan Group. Surili is also the co-founder of AWAZ for Climate, which, if you're not familiar with the word AWAZ, I believe the best English translation would be Voice for Climate, an inclusive community for professionals dedicated to climate and health. And Surili was also previously the director of the Center for Climate, Health and Equity at the American Public Health Association. So no offense, my dear friends and speakers, but I am going to put on a 5-minute chime. So Cheryl, I'm passing to you. And if you hear a chime, it means you've gone 5 minutes.
Okay, good afternoon, everyone. It's been a great session. And I had slides. I'm not sure they're going to come up, but my key points am I supposed to share the slides or were you going to share them? Hello?
Can you see them? I have them shared.
Yes, we see them. And Cheryl, just go ahead and give a voice prompt and Colin will forward them for you.
Okay, if you could do the first slide. This is the key points. This was at the end. But my first slide was the heat wave. Well, I'm sure we've been, yeah, here we go. Thank you. Well, good afternoon, everyone. We've heard some great presentations earlier, lots of solutions. I know I'm speaking to the choir and it's always wonderful to be here. And we just got the Intergovernmental Panel on Climate Change report, and it's been clear that the many health impacts, and this I always use to show all the summaries, and you've heard it before, the heat illness, the exacerbation of heart and lung, the asthma, traumatic injuries, emotional, mental health issues are so real. But what's most important, that is just the tip of the iceberg. There's so much more research that needs to be done that would really reveal even more and more health impacts. We've heard about the preterm labor, the correlation with mortality, with maternal mortality, especially among Blacks. We're hearing about ALS. with relation to the neurotoxin from algae bloom. We're at the tip of the iceberg in how climate can impact health. Next slide. And you've heard it, Todd Sachs' presentation, where it brings it to the doctor. You've heard this data before, nurses, doctors, pharmacists. We are trusted messengers. Why can't we use this information and use that trusted messenger to bring that message? Next slide. And as trusted messengers, and you've gotten so much information from this conference and from all the other resources that you've been shared with, as we get this information and we start sharing it and we see all the solutions, I love this slide that I got from the coronavirus pandemic, which shows that a problem, any problem, is going to require multiple solutions. And we share responsibilities, we have personal responsibilities. This is with coronavirus and at the end, but I'm trying to get that graphic designer who's going to help me put these shared responsibilities of decarbonizing the health, of changing the electricity, all the changes that we can do, transportation, all the sources and our individual responsibilities, and how that then leads to what the IPCC report is showing, that we have to get to adaptation and mitigation. Next slide. As we continue to decrease our greenhouse gases, and the most important thing is policy. Policy matters. And I bring this up with policy of a policy in 1619 with slavery, as we know, which created a devaluing of humans. And in that devaluing of humans, it led us to be able to feel very comfortable in leaving these toxic institutions and these cancer alleys and the pollution, because some folks were being injured more than others. It allows us even now to say we won't make these changes, understanding that there are different species and islands and people who will be impacted. Policies matter, and we have to take the change. Next slide. Next. And as we look at these solutions, I love the summary report in the IPCC, which they clearly understood, and they said in the report that the livability and the changes that we do has to start now. But we must pay attention to the income inequalities, the inequities, because that has even more impact in the long run and will benefit all of us. So as we look at how the changes come, we do have to center the populations that Armin just described that are most vulnerable. And in our country often translates to the poverty and Black and brown and all the inequalities. And how do we get those resources there and solutions there, because that benefits all of us. Next slide. Oh, I think that's my last slide. No, here we go, key points. Thank you. So when we think about it, everybody knows the health impacts that are coming. We have to prepare our population. We have to tell our patients. We have to connect the dots for them. And Andrews gave a great way in how to do that conversation. We're trusted messengers. Take these 22 million workers. No intervention, it must be shared and personal, and we have to be brave as clinicians. We must tackle the policies and we must make these solutions equitable. Thank you.
Thank you, Cheryl. That was absolutely terrific. Really appreciate it. And next, we're going to turn it over to Nicole Redvers, excuse me.
Thank you, Lanatea. Hello, and thanks for the kind introduction, and also to my fellow panelists for continuing this important work for our Mother Earth. And Salutina, all my relations here present with us today, I thank you for being here to participate in this collective effort in a time of such great need. And the only way we will get through our existing crises is together as a collective global community. And I refer to you as Salutino, or all my relations, as we are all interconnected on this planet, made ever clearer by the current shared experience of this current pandemic and that of the climate crisis. Now, I come from the land called Denede in this Canadian subarctic, which is the land of the people. And we are Dene indigenous peoples. And if we break down the word of my peoples, dene, de means flow, and ne means land. We are flowing from the land as people. We have a relationship with the land. Our very being flows from the land and the land from its people. And this concept of flowing from the land roots us dene peoples in our landscapes and also creates the culture. And as such, the teachings about the land serve as the essence of our being. There's no separation from the land, and when there is, health dysfunction arises. And this means that by going on our own healing journeys and by taking our patients on their healing journeys, we're automatically in healing with the land and the planet itself, because we are in and of itself nature. We are nature. So with this, I see all of you as already partners in the planet's healing, as we are part of this planet together collectively. However, I'll encourage you to set a clear intention to consider yourself a direct partner in planetary healing. Now, my home region in the subarctic of Canada has already surpassed the Paris Agreement target for temperature rise within our region currently at 2.7 degrees Celsius over pre-industrial time due to the amplification of temperature rise within the Arctic. Yet my people have contributed, like many Indigenous peoples around the globe, the least to the current crisis we face. And this change has precipitated a dysfunction, with the effects of climate change already being felt today through our animals, through our landscapes, and through our people who have had a deep connection to their land for thousands of years. Now, Indigenous peoples have developed knowledges over thousands of years about their natural rootedness, and they have actively maintained their vast ecosystems through reciprocal relationships. Indigenous traditional knowledges have in turn served, often without explicit consent or acknowledgement, entire nations for generations by providing ecosystems and provisioning knowledges such as foods, medicine, and mineral resources. Now, the extraction of knowledge and resources through forceful colonizing agendas has, however, created a disconnect between the original meaning of the knowledge and how this knowledge is used within current landscapes. Now, this creates a dangerous and precipitous situation where the realities of our existence have been stressed to the breaking point, as evidenced by many current global environmental, but also political changes. And this is why it's so important in this work to respectfully draw upon diverse knowledge practices beyond Westernized disciplines, including those of Indigenous peoples. However, only through free, informed, and prior consent. My Indigenous community has had a traditional Indigenous medicine system that has existed for thousands of years, that is evidence-informed, empirical, time-tested, sustainable, and net zero. In our traditional medicine systems, the environment is not separated from the patient. They are utterly and completely interconnected. Any treatment, any prescription, any recommendation is done in concert with the patient's reciprocal respect and responsibility to the lands and waters around. There is therefore no separation between the health of the planet and the health of the patient. In the consideration for a prescription, they are joined. In fact, many prescriptions or treatments are done with a specific intent to ensure there are co-benefits for the patient and for the environment and planet. Now, in following this example, we urgently need to reorient all aspects of Western healthcare systems towards planetary health, from procurement, energy sources, healthcare efficacy to waste reduction. And we've heard if global healthcare were a country, it would be the 5th largest climate polluter on the planet. So although climate change increases the healthcare burden and prevents adequate healthcare provision in many contexts, current carbon-intensive models of care damage the climate and our overall well-being. Next slide. With this, I encourage you to take in and absorb the pledge for planetary health that we developed to provoke thought and reflection and hoped action on health professionals' role within our current world. And with this, I very much look forward to the other panelists' presentation and the important discussion today. And I thank you to the host and moderator for opening up the space for continued dialogue. Masicho, thank you.
Thank you, Nicole. And now we'll pass the microphone to Dr. Erica Browne.
Thank you. So for the brief time that I have, I'd like to share some information about the Climate Change, Health, and Equity Initiative that is sponsored by the Kresge Foundation and is really led by the work of many of my co-panelists and organizations who serve as partners for us. So the Climate Change, Health, and Equity Initiative, which we sometimes refer to as the CHI Initiative, is a national 5-year, $22 million coordinated effort to mobilize climate action among health institutions, health practitioners, and community advocates. And our intention is to do that by focusing on 3 strategies. 1, to build capacity within health institutions. 2, to transform healthcare and public health practice. And 3, and really important to the initiative, is to strengthen community-based leadership. Now, in terms of the focus of this panel, which is optimizing and accelerating the power of health professionals, there are 3 relevant points to the Climate Change, Health, and Equity Initiative that undergird our work. First, we know that health practitioners, and you all know this from your daily work and service, you all have the capacity to engage patients, colleagues, and policy leaders. Second, we believe that there's a unique opportunity for health practitioners to influence practice change within health institutions and policy change within the communities that you serve and provide care for. And then lastly, we recognize that there's an important role for philanthropy to be responsible and to help set an equitable table for engagement, to steward partnerships and relationships, and to reinforce the necessity of community-led, community-centered strategies that help us advance our goals around both climate resilience and health equity. Next slide, please. So because you as health practitioners have the knowledge, the credibility, the trust to engage patients, colleagues, and policy leaders, our health practitioner strategy focuses on building that capacity further for healthcare and public health practitioners to incorporate climate-related health issues into your work, as well as community-level impacts into your practice. Similarly, because of the unique influence opportunities that health professionals have, the strategy focuses on supporting the ability of health practitioners to prominently feature climate change health impacts across your networks and professional societies. We recognize that this influence and advocacy can happen both within healthcare institutions where you work and also within the communities where you serve and practice. In terms of this strategy, we are very fortunate to be able to partner with organizations like the Alliance of Nurses for Healthy Environments, the Medical Consortium on Climate and Health, the American Public Health Association, and the Michigan Community Health Worker Alliance. And our intention is to support practitioners in their ability to use their organized power to influence policy and practice that centers community, equity, and resilience. And then lastly, and importantly, as a foundation, it's our desire that this work is in service of deepening and sustaining relationships that support equitable cross-sector strategies and improve opportunities for both health outcomes, positive health outcomes, and climate resilience. So in closing, I just want to offer that there's a responsibility that philanthropy has to be a responsive and supportive and an engaged partner. And my hope, my intention in participating in this panel is that it will give me an opportunity to learn how the CHI Initiative in particular can help support the work of health professionals, and philanthropy as a field more generally can be a more responsive and engaged partner in this work. Thank you. Thank you, Erica. Really appreciate the work you're doing. Next, I'll pass the microphone to my friend Markley Alexander, who I had the pleasure and the honor of representing the Medical Society Consortium last fall at the COP26 meeting in Glasgow. It was quite the experience that Markley and I had the opportunity to share.
Thank you, Ed, and thanks everyone for letting me speak today. To set the stage for my comments, I want to harken back to the title of this section, which is Optimizing and Accelerating the Power of Health Professionals. So to accelerate our progress, I think it's important that we have a vision. And so I want to share my vision. And my vision is that healthcare professionals and medical schools are places where climate change is not only incorporated into education, but also into the fabric of the being and the culture. Climate ethics need to become an important part of the conversation. And I'm hoping that someday some of the buildings we're using now for pathology are actually transformed into exercise and wellness centers. I also love Dr. Lewandowski's scripting and would like to see all healthcare professionals incorporate scripting and climate change into their care, and that the single-use supplies we use now all become biodegradable, in addition to many other changes we will make. But most of all, I see a change in the healthcare pendulum so that we're not in a society where we're responding to our stressful, materialistic environment, but rather we live in an environment that is accessible, holistic, mindful, and nature-based. And I'm so happy to hear everyone's discussions about this. The journal is a place where I hope you'll all consider going for information. And one of the key points that we've discussed in the recent past is the issue of how healthcare professionals can be clear to solve the climate crisis. And just want to bring this to you. We all need to be communicators. We know that we have the power. The issue is, have we used it yet? We all also need to be climate leaders. And I would say that the ones of us that are here today are climate leaders, but we're also a very small number. There are millions of healthcare professionals in the United States, and many of them live in states like where I live, Alabama, where sometimes even health professionals don't believe in climate change and think it's a bad thing to talk about in practice. To change that, we've got to be educators at all levels, and we've got to be advocates. In fact, the way I got into this area, Ed had said that I work in disability and climate change, was I got tired of trying to speak at PM&R or rehab meetings and be shut down and not have my presentations about climate change accepted. So I decided instead I was going to walk. And I started walking, and I'm still going to finish my walk, but I walked from Canada to Rocky Mount, North Carolina, where I knocked on doors to give grand rounds as opposed to just being invited. And that was my own unique way of advocating and getting my message out there. I think we've all got to look at our own stories and do this. And finally, being researchers. This is key for our future in terms of helping people. Next slide. One thing I realized in my exploration of the climate and health sphere and climate change in general, I think one of the things we've got to be very, very, very careful about is the issue of solidarity. This is an existential crisis, and it's very important that we all work together. I do worry a bit because there's so many local conferences going on, but we still don't have many national conferences like these. And in my vision, I want to see national and international conferences where young students are submitting abstracts and giving presentations. And of course, the Journal of Climate Change and Health will ultimately be where these presentations and these abstracts will be published. To get to this existential crisis and get it off the map, the key, though, in my mind, is community. And I think that we have to think of two levels of community, because community can conquer climate change. Next slide. In terms of sustain our abilities and the organization I lead, one of our biggest projects is something called Day for Tomorrow. And you might say, what's Day for Tomorrow? Why Day for Tomorrow? Well, you can see it's actually an idea of a day which we celebrate on October 22nd. And it's called Day for Tomorrow because we never know what's going to happen tomorrow. Right now, the temperature might be 21 day and then 80 the next. So tomorrow is something we now have to be prepared for. And why is community so important? Well, when disaster strikes, your neighbors are crucial. And if you don't know your neighbors, you're not going to be as able to help them. So preparedness in advance is important. Another issue is our built environments prevent active transport. There aren't sidewalks. Walking on roads is unsafe. And hopefully that will be changed in our green future. Again, the fast-paced schedules we go through, those are all contributing to climate anxiety, climate stress, solastalgia, and it goes together with our decreased physical activity and time in nature. Of course, we're still using fossil fuels, and we hope that the transition comes immediately to sustainable fuels. But Day for Tomorrow was an idea that we came up with for people to join in community. We have a theme in this program about community. The question is, how can we get it out there? And how can we get people as healthcare professionals to know their neighbors and appreciate nature? This is one idea of many. And my last slide. So in addition to our personal communities, communities with our neighbors, which can be at any level now, we know because of Zoom and being able to talk on the internet, there's also the issue of our professional community. And I was fortunate to watch Gandhi recently, and he talked about the need for a journal. So I felt very validated about our journal, the Journal of Climate Change and Health. And if you haven't seen it, please, it's green open access. And there have been many papers written in the journal about the practical solutions we have seen today. One of the other practical solutions we haven't heard about is waste audits. But we can all start. We can all start in our environments, bring up the conversation, say something to one of your colleagues at work about climate and health, but also say something to somebody in your neighborhood. We need to continuously communicate and collaborate. And I will say too, in 2022, we are going to have 2 special issues of the journal. One, which is being led by Ed Maibach and his team on communication and climate change, and another one on collaboration, which is being led by Dr. Redvers and Arthur Wins on collaboration. Because just because we're healthcare professionals doesn't mean we can solve everything, but if we are part of a community and part of a team, we can make changes and be part of this green future that we all need to have. Thank you.
Thank you, Markley, for all you are doing. Last, we'll hear from Cyrilli Patel.
Hi, everyone. Thank you for the invitation to join this incredible panel. I am truly in awe of what all the fellow panelists have said already in the panel before and even just this morning, and I'm holding it with me. I want to start off with a story. Like many of you, I have seen many climate disasters shake communities and disrupt the lives of people. And in this story, it includes my own. In 2008, I was in Baton Rouge during Hurricane Gustav. Our neighbors across the street, like many families, had evacuated to safety before the storm made landfall. And thankfully so. While they were away, a tree fell on their house, flattening their entire dining and family rooms. Once the storm passed, we all stepped out to assess the damage. And it was then we heard the sounds of a wounded dog. That same tree that fell on the house across the street also tore down a fence where a dog was leashed. We rescued the dog immediately, and when neighbors got wind of what happened, they began to bring over food, water dish, and other items. Eventually, we saw neighbors coming together to help each other out, from picking up debris on their lawn to repairing windows. This shared experience brought our neighborhood together in such an uncertain and difficult time. But not everyone in Baton Rouge was that fortunate. Power and phone lines were down for several weeks in some places, and the food in our fridge rotted. It was simply put a hot August. I even later found out that my office building was deemed unsafe for reentry, as many homes and buildings across Baton Rouge were. And gas was in shortage, so prices skyrocketed and it became almost impossible to move around. People stood in long lines to receive public assistance to replenish the food in their fridge. It was dire. I recall this experience often when working on the intersection of climate, health, and equity today, because I remember that I am just one person and that the wins of myself are attributed to the wins of my colleagues and my partners, as well as the communities we're a part of and the communities we serve. And I feel truly fortunate to be in community with fellow public health and health professionals who care deeply about the causes and the people we serve. And what makes our work especially difficult is that when we're surrounded by societal injustices and one crisis after another, and the swarm and volume of information we find in the news and social media can be dizzying. There's no denying that the injustices of the past are still being lived, experienced, and perpetuated in contemporary forms. And to cut through the national debates and the ideological and political divides, I am certain our work needs to reflect and should be rooted in community experience, expertise, and wisdom. There is magic in listening deeply to those disproportionately impacted that goes beyond information gathering. When I set foot into a one-on-one interview or focus group or any space that I share with someone and I ask them what their concerns are, I try to listen deeply and I try to suspend judgment. People have thanked me for asking them what ails them, physically, emotionally, socially, because they're often not being asked the question or felt that they're heard. As I reflect back to them what I've heard with authentic curiosity and concern, I often witness the start of a beautiful relationship unfold because we've built one on the foundation of mutual trust and respect. No matter how much health and health care tends to an individual, health is nothing but individual. It is social. And so too is the road to healing. This work is hard. There, I said it. It's hard. It's hard to work daily on an issue that we all see as the biggest threat to humanity, the biggest threat to human health. Today, it's even harder when we see how geopolitical activities halfway around the world have profound impacts on our lives, for ourselves and for those near. And to top it off, the IPCC report paints a troubling picture. Yet political leaders refuse to take action that's corrective, and we're beating our chest trying to get someone to hear us. All this work can be depleting. Overworking and overworrying is not the way to solve the climate crisis. A wise colleague of mine once shared that healing is not a one-time event. Healing is an everyday practice of transforming your feelings and alchemizing energy. Healing cannot happen at the level of your thoughts or rational brain. We need to invite a practice of healing into the work that we're already doing and taking on. Another colleague of mine wishes, and I too hope, that we can adapt productivity to reflect humanity and to be kind to ourselves so that we can show up for the issues and causes we work for here collectively and in the healthiest way possible. We also can invite self-compassion. This work is not a sprint. We are running the marathon of our lives, and we can only succeed if we succeed together. Finally, next slide, please. I want to leave you with this quote by Maya Angelou, and because it reminds me to put the humanity back into the challenging work that we do. As I turn it back to Ed, I hope that you will join me in making a promise to yourself to practice self-compassion and exhale any harm and rejuvenate your lungs with the knowledge that we're in community together. Thank you.
Well, thank you, Surili. That was lovely. And actually, I'm going to turn it right back to you. We only have about 7 more minutes, but I'm hoping that every one of our panelists can answer very briefly the following question, which I've heard described as the magical question. The magical question is, what would it take, ... question mark, So I'm filling in those ... with what would it take for the health community to dramatically accelerate adoption of equitable climate and health solutions over the next year, so that next year at this time, when we get together, we can like open a bottle of champagne because we can be so proud of ourselves for what we accomplished in the next 12 months. Cyrilli, you first, please.
We're going to cut right to it. If you're able to, please vote this year. I know it's a midterm. Register to vote. There are so many different practices out there trying to dismantle our democracy. Get to know your polling place. Get to know how to vote by mail. Well before November, that is too. Learn about the candidates up and down the ticket. And if you're unable to vote due to citizenship status, criminal justice system, or any of the other reasons for disenfranchisement, engage in community organization. While there are a lot of political decisions or policy decisions happening at the national level, there are more immediate ones taking place in our community. Local officials are responsible for our environments, our parks, our schools, the criminal justice system. So many things are happening at the local level. So please, I implore you to get to know the ballot and vote. And once you've done that, please try to get out the vote in your community.
Thank you, Surili. Markley.
My comment would be that every day we each talk to one healthcare professional and one non-healthcare professional. And we talk to them about climate change and health, and we ask what action will they take and what action will we take. And if we can get every person we talk to talk to another person, we will start things going. I think we've all got to be out there, and this has to be so much a part of our lives. But the thing is, a lot of times we're so busy, we're so worn out, we might feel it inside, but it doesn't come out of us. So we've got to let it get out of us and share with other people.
Beautiful. Thank you, Markley. Erica.
I am going to cede my time and drop a link in the chat that offers some possibilities for what people can do on an individual level, as well as what organizations can do. It's work that Healthcare Without Harm is moving forward to think critically about what climate smart health systems might look like. So I will drop the link in the chat and allow someone else to share.
Fantastic. By the way, I've never seen that happen before. So that was a breathtaking first. Thank you. Nicole.
Thanks. Great suggestions, everyone, and such important recommendations. Just want to share a couple of points that we found very successful in the Canadian environment. One is, as of last week, the official test for medical doctors entering practice now has to include climate and health as part of that. And we strategized on that component because by making it a part of the test requirement ensures, of course, that people have to learn about it at some point within medical school. So that was a sort of sneaky back end way of ensuring that got done. The other thing that happened at the national level recently was the creation of a task force of the Associations of Faculty of Medicine Canada with the goals for urgent action change within not only medical curriculum development, but also professional development, post-graduation, as well as policy changes within all of the respective colleges and faculties of medicine within Canada. And that was as a result of medical students, primarily in terms of their advocacy. So I want to also note the importance of promoting our students because many of our young people are so envisioned and impassioned within this area. And many of them have said that they felt alone in this process of advocacy. So the more that we can stand up for our medical students and other health professional students to enact these changes, not letting them take the call on their own, but also supporting and doing our own action at the same time. So I'll leave it at that because I know we have time short. Thank you.
Thank you, Nicole. Cheryl.
Ditto, everyone. I think what I see that's missing now is the role of the hospital system. So when you look at how health sector and how everything is paid for, and even an academic center, think of that big wheel bicycle, the health clinical part, the hospitals, the clinics, then pull along the education and research. If we can get that whole infrastructure connected with each community and have a responsibility within the community, we automatically have payment, we have education, and we have a commitment to decarbonizing and a commitment to educating and developing the disaster relief. within a structure that's in existence.
Oh, very nice. We have 1 minute. I'm going to use it in an unusual way. I'm going to paraphrase something that I think I heard all of you say, which is that to get through this marathon, we need a lot of love for each other, a lot of love for ourselves. And I have a new friend who I've met over the past year, who is the most amazing love creator I have ever met. And today is her birthday. Dr. Waldman, would you like to say hello? Because we would like to greet you, to offer you a very, very happy birthday.
You're going to bring me to tears. Well, I just want to say the Medical Society Consortium is one of the best things that ever happened in my life. Thanks to all of you, especially Dr. Mark Mitchell for his exemplary work that he's done, his vision to start our Climate Health Equity Fellows Program. It's just volumes of information that we have learned. We've learned so much from you, Ed, and all the speakers. It's phenomenal. My whole world has changed. And this is something I talk about every day. And I know some of my patients and my colleagues get tired of hearing it, but I said, until we see change, until things get better, we cannot give out, give in, or give up. We have got to stay steadfast to mitigate climate change once and for all, so that we can eliminate air pollution, improve our health, and move on with our lives. That's the only way.
Thank you, Linda. And our lives got better the minute you walked into them. So thank you for all you are doing.
Thank you.
With that, Mona, I'm going to pass the microphone back to you.